Welcome to Thursday's edition of COVID-19. Authorities are reeling from a shocking surge in daily infections as we have almost 600 cases today. And this comes with just a week left until some 500,000 test takers come together to sit the annual Scholastic ability test. We have details on that later on the program. Here first is our Kwon with the latest on the pandemic. Now, so I hear we have 583 new cases here in Korea, a figure that we have not seen since early March, is it?
Right, Sunny. Many will remember that time when Korea was dealing with its first massive outbreak, which was stemming from Daegu in Gyeongsangbuk-do province. As Sunny just said, 583 cases were confirmed this Tuesday, and it's the first time since March 6th that we see a number above 500. Also, 553 of those were local transmissions, and that's 190 more cases compared to yesterday. Now, combined with imported cases, Thursday's caseload has jumped by 201 compared to Wednesday. And that raises the total here in the country to 32,318. And we also see a rise in the number of people that have been quarantined at 456.
So how are authorities here assessing the sudden spike in daily cases?
Well, Sunny, it hasn't been that long since officials started to describe the current situation as the third wave of the virus here in the nation. But today's caseload already is higher than the 441 cases hit in late August, and that was during the second wave, that is. And here's Health Minister Bang Neung-hu with an assessment earlier this morning.
We've confirmed more than 100 recent cases linked to a sauna inside an apartment complex, as well as over 50 infections linked to an aerobic center and a military training camp respectively. The percentage of young patients in their 20s and 30s has also risen to 28% of the total in the past month.
You just heard it. Those are the reasons for why we are having these numbers here on our map. While yesterday we had a total caseload a little below 400, this Thursday we see over 400 here in the metropolitan region alone, 213 in Seoul, 183 in Gyeonggi-do province. And that's not all. We also see 45 cases in Gyeongsangnam-do province, 22 in Busan, and also many other regions with double-digit figures, as well as 30 cases that were categorized as imported cases. And with that, let's take a look at the global figures as well. We have 60.7 million cases around the world, with over 616,700 new infections reported in just a day. Let's take a look at the numbers here of the 20 countries with the highest figures of infections. The U.S., 13.1 million. Many worries of spreads here during Thanksgiving. Also, European countries like Italy are getting prepared for Christmas, as in a month it is Christmas there, and also they are having preparing for extra measures during that season. So let's take a look at the daily rises in the U.S. over 182,000, almost 183,000, I should say, 25,000 cases in Italy and 20,000 in Germany. And those are the updates I have for now. I'll be back with more after the government briefing. Back to you, Sunny.
All right, so thank you for now. On the local front, again, efforts continue to ensure public health, and it appears such dedication will continue even in a post-pandemic era. Now, for more on this endeavor and other related news, I have our Kim Dami here in the studio. Welcome, Dami.
Good afternoon, Sunny.
So, Dami, let's start with Korea's recent enrollment in a global foundation for vaccine research.
Right, so SARS Foreign Ministry said on Wednesday it joined the Coalition for Epidemic Preparedness Innovations. It's a global partnership to develop vaccine and fight new infectious diseases. The government has pledged to donate $3 million each year until 2022. Through a virtual meeting on Tuesday, Korea's ambassador to Norway signed onto the partnership with the head of the foundation. It was founded in 2017 and has funded research projects to develop vaccines against new diseases like MERS and SARS. It's currently supporting the development of 9 COVID-19 vaccine candidates, including those from Moderna and AstraZeneca.
Right, Tammy, I also understand health authorities have revised their distancing and daily life guidelines to reflect the severity of the third wave.
Right, so this is in line with the level 2 distancing measures that are now in effect in the capital region. The KCDA once again highlighted the importance of public cooperation and following the guidance amid daily settings.
Public cooperation is a must in cutting off transmission pathways of the virus in everyday settings. Since level 1.5 social distancing guidelines were issued in the Greater Seoul area on November 19th, mobile phone data shows that population movement fell over 10% last weekend compared to a week ago.
The new guidelines include an expanded mask mandate, more frequent ventilation, and voluntary self-isolation in case of suspected symptoms. Indoor concert halls and door-to-door sales offices have also been recategorized as high-risk public use facilities. That's in addition to the previous 9 different types of venues, which include singing rooms. Arcade logistics centers have also been added to the list of facilities under watch. Golf clubs, postpartum care centers, and lodging facilities will also be monitored.
Tami, also, the foreign media has praised Korea's efforts to tackle the double threat of COVID-19 and the seasonal flu. Tell us more.
Right, so the New York Times on Wednesday praised Korea's success in taming down the concerns related to the country's flu vaccination program. It credited Korean scientists for quickly determining that a string of deaths among people who had been vaccinated were not linked to the flu shots. This followed a storage mishap involving millions of doses of the flu vaccine that may have been exposed to high temperatures. So the government temporarily suspended the program to investigate, recalling around 480,000 doses of the vaccine. The New York Times praised Korea's health authorities for their transparent disclosure of data regarding the investigation and for quickly getting the vaccination program back on track. Elsewhere, Bloomberg published a list of the best places to be amid the pandemic, where COVID-19 has been handled most effectively with the least amount of disruptions to business and society. So South Korea ranked 4th on the list for its effective epidemiological response, its development of homegrown test kits, as well as innovative solutions like drive-through test centers. And New Zealand came in first for its quick decision-making, issuing lockdowns in the country even before the first death from COVID-19 was reported. It was followed by Japan in second place. Bloomberg noted that Japanese citizens were diligent in avoiding crowded places and wearing face masks in public. But Japan's ranking has raised a few eyebrows, considering that the country's daily caseloads have reached record high levels of over 2,000 in recent days. Other countries like Taiwan, Finland, Norway, and Australia rounded out the top 10.
Right, I mean, one final question before you go. I hear over in the U.S., authorities there are looking to shorten, that is, the quarantine period related to COVID-19.
Right, so federal health authorities may shorten the recommended 14-day quarantine period for individuals who have been exposed to COVID-19. They say it's a part of efforts to make their guidance more palatable to the public and improve compliance. An anonymous federal official told the Wall Street Journal on Tuesday that the agency is always reviewing its guidance and recommendations to reflect new discoveries and understandings of COVID-19. The official added that the change will be announced when appropriate, and CDC currently advises people who may have been exposed to the virus to isolate themselves for 14 days to avoid infecting others. South Korea, in the meantime, has given no indication that it will change its current 14-day quarantine period.
All right, Tami, as always, thank you for that coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular briefing on COVID-19 here in Korea. In a span of 24 hours, Korea has seen its daily tally surge by more than 200 cases to record 583 on this Thursday. Now, granted, compared to its counterparts in the West, the daily tally is not as alarming, but for a country that hasn't seen such a number since early March, it is quite a concern. I believe the briefing is about to start. We will come back to you afterwards with a summary of that.
First of all, we have Mr. Lee Sang-won with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of November 26th, Thursday, we have 553 new domestic infections and 30 new imported cases. The total caseload now stands at a total of 32,318. Currently, we have 4,853 people remaining in quarantine, undergoing treatment, and we have 78 patients in severe or critical conditions. And as of yesterday, we had 2 additional fatalities, raising the total death toll to 515. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the major updates on our domestic infections by region. First of all, in Seoul's Gangseogu district, in relation to a dance academy, we also have the first case being identified this month, and we have 65 additional cases, raising the total to a total of 66. And Seoul Seochogu district, we have the second sauna, and in relation to this place, we have 9 additional cases being confirmed, and a total of 48 have been confirmed to date. And in relation to a church in Mapogu district in Seoul City, we also have 13 additional cases being confirmed, and a total of 119 have been confirmed to date. And in the Gyeonggi-do province, Yeoncheon County, in relation to a military training camp, we also have the first identification of the first case earlier this month, and we have 67 additional cases, raising the total to 68. And in relation to Janggu lessons in Busan and Ulsan cities, we also have 6 additional cases, raising the total to a total of 53. And as for detailed data for other cluster infections, please make your inquiry to the spokesperson's department following the briefing. And today, we would like to focus on the individual clusters, which will be revealed after the briefing because we have a high number of infections. So the Republic of Korea is currently undergoing and fighting against a third major outbreak. And nationwide, we are seeing sporadic outbreaks of cluster infections nationwide, ranging from venues like eateries, saunas, and military units, as well as other multi-use facilities. And right now, rather than one large cluster infection centering around a region, we have small cluster infections that are carrying out at various regions nationwide. And we have seen more diverse sources of infection, and we also have identified that the younger generation are spreading the virus. And in the terms, in this perspective of the quarantine authorities, this also means that we have a broader range of people who are subject to our intensified monitoring. And if this continues going forward, and we believe that the upward trend will continue until this week, and we believe that on a daily basis, until the early December, we could expect to have our daily cases hover around 400 to even 600. However, we believe that if the social distancing measures, the toughened measures are intensified and are practiced, starting from next week earlier, and we believe that these numbers could also subside. And we believe that generally the measures, the effects of the toughened measures yield a week or 2 weeks following the toughened measures are imposed. So we ask for the public's cooperation in this aspect, and the quarantine authorities will also exert its full efforts to cooperate with the local governments. And we would also like to provide some detailed information regarding the cases that have been showing right now, and we believe that the wearing of face mask is very important. And in Seoul's Gurogu district, at a single hospital, we have seen that a confirmed case has exposed the virus to 39 people. However, 4 patients were confirmed. However, the medical staff were not confirmed from the virus. And also, we see that there are widespread local transmissions, and in Seoul, especially for instance, the users who used the saunas, 20 of them have been infected at a single sauna, and at another fitness club that was visited by the same person also confirmed 26 cases. So this is a chain of transmissions that we are witnessing right now. And the quarantine authorities is currently focusing on the fact that we will try to contain the virus of transmissions like nth transmissions by containing the virus and cutting off the chain transmissions. So this means that we need to break the chain of transmission stemming from one person to another person and clusters as well. And right now, the ongoing upward trend of the confirmed cases is also carried out, and we believe that we cannot contain the virus simply with our quarantine measures, and this means that in order to safeguard the safety of our individuals and the community, we also like to urge the public the following. Wherever you are, if you are at a crowded place or a confined place, please note that these places could have higher risks of infection. So please refrain from going to non-essential outings or gatherings and events. And if you have symptoms and if you do not feel well, please visit a clinic and get tested as soon as possible. Please note that testing yourself as early as possible is very important. And moreover, for the sake of the safety of the entire community, it is very important that we also need to encourage people around you to get tested as soon as possible.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입기자단으로부터 먼저 받은 질문 5가지 드리면서.
Right, so that was Lee Sang-won at the Central Disease Control Headquarters with Thursday's afternoon briefing. I believe he touched upon the possibility of daily cases hovering between 400 and 600 infections. Tell us a bit about that.
That could be possible, according to him, if we take a look at the recent trends, because we are seeing various cluster infections breaking out at various places. So that is why he has been mentioning that concerning figure, but it may not happen if we do abide by the social distancing measures, because he just mentioned the level 2 social distancing measures in the metropolitan region and also other places of the country may kick in. The effects may kick in beginning next week. So as of yet, it looks like there is no decision being made on another raising of those measures, although we have already 2.5 social distancing measures in the military, which begun today until December 7th. Now we're seeing a lot of new cases linked to our daily lives. For instance, at a dance class, at saunas, cases linked to a church and also a military unit, a music academy. And it looks like nowadays the government cannot even mention all of those during their afternoon briefings. That's how many cluster infections we are seeing right now. And also there are many more younger people that are getting infected, which is making the management of the quarantine measures even more difficult. So social distancing is what needs to be done right now, and especially with just a week ahead of the college entrance exam.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Meanwhile, talk about vaccines has been making headlines in recent days following advances in related efforts by leading pharmaceutical companies. Accordingly, in this next report, we seek to answer your questions about COVID-19 vaccination.
Around 90 COVID-19 vaccines are now undergoing human trials, and several lead candidates have grabbed the media spotlight with promising early test results. Although the vaccines vary in type, inoculation method, and preventive effects, there are growing expectations that the world could soon have a powerful new tool to control the COVID-19 pandemic. The majority of people across the globe say they're willing to get a vaccine as soon as one becomes available. Recent survey results show that roughly 7 out of 10 people in the world wanted to be vaccinated. According to Global Vaccine Alliance, Gavi, at least 60% of the world's population needs to be vaccinated in order to achieve herd immunity and bring an end to the pandemic. So who should get the first doses of the vaccine immediately after they become available?
고위험층을 중심으로 맞아야 되는 것이고요. 대표적인 게 노년층, 그리고 이제 만성 질환자들, 그런 분들이 맞아야 되고, 감염된 분들은 항체가 얼마나 지속되는지가 중요한 건데요. 자, 예를 들면 독감에 걸린 분들은 작년에 걸렸다 해도 금년에 예방주사를 맞지 않습니까? 마찬가지로 코로나에 걸렸는데 항체가 한 1년이 채 못 간다. 그러면 다음 해에 코로나가 아주 심하게 돌 때는 백신을 맞아야 하고요.
Despite growing calls for equitable vaccine access, there remains a concerning gap between the haves and the have-nots. Although AstraZeneca is offering its vaccine at $4 per dose, others have a more prohibitive cost, topping out at $72 per dose at the highest end of the scale. In addition to the vaccine itself, the cost of distribution and cold storage could be unaffordable for countries that are either underdeveloped or in serious recession.
다른 기술들이 적용이 되었기 때문에 생산하는 가격, 비용이 다를 수가 있다는 거죠. 개발도상국 같은 데서는 다른 국가들에 비해서 아무래도 비용이 늘어날 가능성이 있는 거죠. 국제적인 공조 시스템을 통해서 백신을 좀 더 저렴하게 이렇게 조달을 받으려고 하지 않겠나 이런 생각이 듭니다.
The Korean government says it is negotiating with a number of global biotech firms to secure an adequate number of vaccines for the country's citizens. However, Korea has yet to sign a firm deal and appears to be biding its time over the still lingering concerns regarding vaccine safety and efficacy.
Over the last couple of weeks in the past, there has been multiple media release from the various vaccine manufacturers on their encouraging interim analysis of the data. However, the clinical trial is still ongoing and the long-term efficacy and safety assessments are not completed yet. Therefore, Korean government has been probably negotiating with the multiple promising vaccine manufacturers with these factors in mind, and will probably make their decision in the near future on what are the best fits for what vaccines are best fit for Korea.
The other question that remains is, how quickly can we restore a semblance of normalcy in our everyday lives once we do have a vaccine that is widely available?
백신만 갖고는 일상으로 완전히 복귀하기는 좀 어려울 것이다. 다만 이제 전체적으로 백신 때문에 많은 면역력이 생기게 되면 극히 위험한 고위험층만 제외하고는 상당히 좀 지금보다는 훨씬 더 평화로운 분위기에서 다음 시즌을 맞을 수 있을 거다 그렇게 보고 있죠.
The world may be inching closer to a safe and effective COVID-19 vaccine, but many challenges and trials yet remain for us to solve.
정부의 힘만으로는 49만 명이 응시하는 국내 최대 시험의 방역을 완벽하게 성공할 수 없습니다. 국민 모두가 도와주셔야만 수능 방역에 성공할 수 있습니다. 우리 국민 모두가 수험생을 둔 학부모의 마음으로 오늘부터 일주일 동안 모든 일상적인 친목 활동을 잠시 멈춰 주시기를 요청드립니다.
The impact of COVID-19 in the academic arena has been extensive, and one tangible proof of this reality here in Korea is the postponement of the National College Entrance Examination to the 3rd of December. Now, for more on the preventative efforts in the education environment, I have Professor An Mi-ri from Hanyang University. Welcome, Professor An.
Good to be back.
And I also have Professor Choi Young-jun from Hallym University joining us virtually in the spirit of social distancing. Good to see you again, Professor Choi.
Thank you for having me.
Professor An, as we saw in the video, the college Scholastic Ability Test has been postponed by 2 weeks. It will take place next Thursday, I believe. Now, this year's Suneung, I understand, will look much different from the ones we've had in the previous years. Please tell us a bit about what to expect.
Yes, it will be like a foreign country. Remember, a couple months ago, we have entered a new normal, and the school setting have changed. But this national examination will be totally different from the outlook and the process of entering the testing site, and the kind of people who will be there will be spending more time to screen students to make sure that everybody is safe and healthy before they enter. And they will be divided for certain students with high fever, and there will be more things that students has to prepare, such as lunch. They have to bring their own lunch. So the environment will be very different. And another thing is that everybody is doing this for the first time. So we have to be very patient and learn to maybe pause and be more tolerant for each other, for those who prepare for the examination and also who would be taking the test.
So even scholars who've tested positive for COVID-19 will be sitting the examination this year?
Yes.
But they'll be sitting the examination in hospitals, is that it?
Yes, if they are confirmed, yes, wherever they are in, which is hospital, and the proctor will wear the
level D protective
suits to visit the hospital to help him or her to take the exam.
I see.
It will be very different, yes.
Professor, and remote learning has been adopted by many schools across the world in light of the pandemic. What has been the impact of online education on the young scholars?
Well, but especially the seniors, this is their first year of going on and offline classes, and also preparation for the tests, and also preparation for college admission paperwork, applications. So they have gone through a lot of stress and psychological strain. So I think more than anything, we have to be, give them more of room to be flexible. And I think because of this online education, the students learn to become more self-dependent or self-independent or self-regulating their own learning. They have to schedule and they have to know where they are, where they lack. So I think what this online education might have done for our seniors is that they learn to become more of their own learning manager.
I see. What is a potential setback, perhaps, of remote learning, a problem?
Oh, there will be a lot. Yes, we were not fully prepared to actually launch online for even, kindergarten and elementary school students. It was just, we did our best. And although compared to other countries, many other countries didn't have enough infrastructure where we had a good infrastructure. Even so, the use of all those systems to cause and encourage learning is another matter. So we have had a lot of problems in initiating the interaction between the teacher and students online, and even checking their, I think every day their absentees and online logging in was a problem in the beginning. But later, we are much more ready now than 6 months ago. However, we have to consider in the future if the online learning has to go on. It's definitely a trend, and we have to use this tool to help the students. So there are a few issues that we need to address before we fully go on online education. I hope we can use that time, the vacation time, winter break, to make it something more usable.
Right,
yes.
Perhaps improve the academic infrastructure. Professor Che, just a week ago, that would be the 19th of November, authorities declared a special 2-week period of quarantine ahead of the National Scholastic Ability Test. Now, essentially, authorities, that is, are calling for public efforts to refrain from activities that could raise risks of community spreads. What are your thoughts on this government campaign?
Right. So I think, it could be quite effective if we meet two conditions. first, if the infection control policies are practiced nicely in the exam rooms, after all, and we have a quite controlled outbreak in the communities. So in this context, we are doing the personal hygienes and wearing masks to reduce the probability of the infections in one person. And we do the early detection and isolation through the epidemiological investigation. And I think we're doing far best among other countries on doing this. So one thing that we can do more at this point is to reduce the number of the interaction between the people, meaning the lowering the contact rate among the population level. And that is the background why we are doing this, enforcing our level of the social distancing despite its numerous adverse impacts. So I think we'll have to wait and see in the next couple of weeks.
Professor Che, talking about the level of social distancing, given today's circumstances, do you believe that we should seek to perhaps raise our level of social distancing?
I think we have already raised our social distancing level in a safer manner, so to speak. But we do have this criteria for the raising the level, and that actually is not based on our we do not have the textbook guideline on raising the social distancing measures. It is basically that we are learning by doing. So we'll have to see aftermath when the dust settles in a few months. But still, we have to wait for another couple of weeks to see if these measures are working or not.
Right, Professor. Professor An, as an academic yourself, how do you assess the preventative efforts by authorities on the academic front?
I think they've done a lot of preparation. It's most important part of our education, and especially for the students. So the test sites have been, I hope I can say bulletproof, but virus proof. But they have blocked the places, and also hygiene has been done. So I think what the school or the administrators, the test proctoring, has done what they can do the best they can.
Professor An, despite the surge in daily cases in recent days, education authorities have dismissed the possibility of another postponement, that is, of the examination. What are your thoughts on this stance?
I don't think we can postpone this Sunung anymore, because we only have about 2 months before the students go through another many layers of college entrance, examination or interviews, and also essay testing. There are many more things to be done. So this would be the last, maybe, possible day in order to work with the colleges and all these processes. So I don't think it will be changed. One of the reasons, as a Minister of Education, addressed that we need to be more cautious for next 1 week for students to self-hygiene and also keep their health so that they can go through this Sunung. But then again, after Sunung is another thing. So while they are in Sunung examination, we have to, I think we should, maybe they might do temperature checking in the middle of the exam or somehow, so that if there is some possibility of students with some kind of high fever or temperature or sickness, they can be addressed to another room, or so they should be prepared for extra room for these situations. And also, I think we need also prepare an emergency vehicle near the test sites, just in case they have to be, relocated. So that's another thing that we can prepare for this Sunung.
Right. Right. Professor Che, staying with what Professor An just mentioned, what happens to kids, or what are the protocols for those showing symptoms of COVID-19 on the day of the test?
We do have this infection control policy for the COVID. especially when there's a symptomatic patient at site. So that person will be headed to the screening center, will get tested. But on bottom of that, there are the protocols to have the students not to miss the exam opportunities by a person escorting for the screening test site and so forth. So I think it basically follows the principle of the infection control policies, not on top of the minimizing the classroom crowdings, but having the person or the student to keep to maintain the opportunity to get tested.
Professor Che, there are almost 500,000 test takers this year. What are the chances of a mass outbreak following this event? And what measures do you suppose are necessary to prevent such a horrendous scenario?
So if we remember, we had a similar event back in April, the congressional voting, that if you remember that there were the rules that required every polling station to maintain the social distancing. They did the temperature screening, wearing the plastic gloves and sanitizers, and enforcing the wearing mask. I think the basic principles are the same. I do worry that we do have the community outbreak and the ongoing transmission at this point, but we haven't seen much of the cases in the schools so far. So I think we'll have to see, but my guess is that the chances could be low if the infection control practices are placed in the strict manner. On top of we have adequate control of the community transmission, but still because of the ongoing community transmission, that is another important factor that we have to factor out. So I think we'll have to see.
I see. Professor An, as you mentioned, taking the national scholastic test is the first step in a long list of college entrance-related engagements, including interviews, of course, as you mentioned. What needs to be done to ensure continued safety on the part of the universities and on the part of government officials?
I think Ministry of Education also suggested for colleges to do an online interview for the admission process. And also there are other, essay tests. What are we going to do about essay tests? And what are we going to do about practical demonstration that involves some arts, majors? But this can be managed, and I think with the Sunung experience and the guidelines that we have kept for Sunung, each college entrance admission will follow much of that process. It will be definitely help for each universities. But even if they do an interview online, they cannot do it at home. They should be at the site, the university designated site. So there will be some students coming and going. So there has to be additional caution and also personal hygiene plus the location. So what I like to suggest is that maybe since the university have their list of the students who is applying and also going through this process, maybe they can have some app or system where they check their temperature and report 3 days prior or 5 days prior to these dates, so that, and then they will come to the site to also temperature. This will be an additional step to prevent and also be ready for the university administrators to foresee any outcoming outbreaks. But then again, that has to be also guarantee that these students who may have temperature will also be able to take that process. They will not be excluded like what we have done for the teachers' certification test. So with guaranteeing they will have a place and process for this admission process, they may be able to report their temperature every 3 or 5 days prior, and then on the day of arrival, they can also temperature, there will be something that we can do extra work.
Professor Che, the test, as we keep saying, is just a week away. What personal efforts should be made by test takers, proctors, and family members to allow for a safe event?
I think for the students or the proctors or the family members, on top of the general rules, they should try to avoid the crowd, especially at this moment, and might want to stay away from the places where people are hanging around, and they should also try to stay 1 to 2 meters apart. And of course, the wearing the mask and avoiding the crowds are the two keys to stopping the COVID spreading. But even the smaller gathering can be a problem if the physical distancing of the 1-2 meters or even cannot be observed. And keeping your hands clean is essential because often people touch their faces or rub their eyes, which gives the viruses to get into your body. So this sounds really simple, but it's not a rocket science, but it can really be effective.
Right. And Professor An, what final academic preparations should be made by test makers for the next 1 week? Test takers, that would be.
Test takers.
Right.
Or keep yourself healthy. That's most important. And be positive. And arrive early. There will be a long line of waiting and going through the process. So, and learn to be patient, so they would not lose their temper.
Right. Professor Che, I understand you studied the spread of COVID-19 within schools. Please tell us a bit about your findings and how it relates to calls against school closures.
So yeah, I work with the government to see the number of the cases of COVID happened in the school-age children after we have reopened the school back in May. Sorry. So we found that it was very similar finding as that was in Taiwan, Japan, or some places in Europe that the schools could be opened safely when there are low community transmission. So if we remember back in April, we had a number of the very low threshold of the number of the cases in the communities. So from I think it was from early May to mid-July, we had around 140 school-age children who got positive with the COVID testing. And among them, only 3 got infected from the schools, and most of others got infected from elsewhere, including their families, houses, and the relatives, and the cram schools, or even the karaoke. So I think the takeaway is that we can have the controlled transmission to school when there's a low community transmission, when we have a right policy of controlling the infection in the schools.
Right. Professor An, given the prolonged pandemic, it appears that virtual learning is taking root here in the world. What can be done to ensure a productive learning experience online?
I think there are many things regarding the legal aspects for the students' class hours and etc. But then again, we need an integrated learning management system that can be easy to access and also interact between students and teachers on that system. That is something that we definitely need, and we need it right away.
I see. And this is not just for Korea, it's for the rest of the world as well, probably.
Many of the countries already have it. USA, France, Canada, they already used it. So it was much easier for them to move on to online, where we had nothing. We had a lot of pieces, but they were not integrated.
So the pandemic has brought us a period where we can actually experiment more. I see. All right, Professor An, thank you very much for your thoughts. And Professor Che, thank you very much for joining us live on the line.
Thank you.
Right, well, that brings us to the end of today's edition. The pandemic is not one individual country's problem. It's a universal plight, and it needs to be addressed through a global campaign. And that is precisely what we will be discussing tomorrow, so do join us then. In the meantime, thank you for watching.